Hello and hello and welcome. My name is Kevin Rockwell, and I'm here today with Carl Shames, who is a neurofeedback therapist based in both. He has an office in Albany, California, but also in Marin County as well. Carl, thank you very much for joining us today. And can you tell folks a little bit at the high level what neurofeedback therapy is?
Okay, well, I'm glad to have this opportunity. Neurofeedback is not as well known as it should be, considering how effective it is for a broad range of difficulties that people have. I think the best way to think of it is to think of ourselves as having, much as I'm hesitant to use a computer analogy, we could think of the hardware, the software, and the operating system. And the level, so hardware would be, the body and the brain and so on, and software might be the, psychological issues, but the operating system would be the functioning of the brain itself. The brain is a dynamic system. So neurofeedback, so for anything that goes on with us and everything that we experience, it's being run through the operating system. So what's happening with our brain functioning affects virtually everything that we do. And a lot of things that we think of in our personality, so for instance, let's say we're prone to anger or anxiety, things like that, or kids with ADD. It's not so much in the personality, it's not in the realm of psychology, it's in the realm of the functioning of the nervous system itself, the dynamic functioning. And this is an area that just hasn't been explored and is barely recognized in the medical community and the psychological community, this particular level of our functioning. But this is the level that neurofeedback addresses, and the results that we get with neurofeedback, the incredible results, demonstrate just how important it is for us to be exploring this realm and to understand it a lot better than we do. So for any given difficulty, and we'll talk in a minute about anxiety, for instance, addressing the functioning of the brain and trying to optimize it and get it to be as smooth as possible, as flexible as possible. That's why neurofeedback can help a broad range of difficulties that people experience.
Now, I don't think that most people think about that. That we have a culture of working out and tuning the body and getting our muscles stronger, tuning our diet so that we have optimum nutrition. But I don't think a lot of people think in terms of tuning up our brains for optimum efficiency. So it's a little bit of a paradigm shift probably for a lot of people to think in that terms. Is that part of the problem why maybe this type of therapy isn't as well known?
Absolutely, and it's interesting that you put it that way, because if you remember back in, I come from New York, and if you go to the beach when I was a kid, everybody's eating hot dogs, and anybody over 30 years old is overweight. Nobody jogged. There was no such thing. Nobody thought about health food. Nobody thought about exercising. Pilates was completely unknown, and I always like the example of Pilates, how one day it was virtually unknown except to a small group of dancers who used Pilates for their training, and the next day there's a Pilates studio on every block. And I really do believe it's going to be the same with neurofeedback. As it is now, when people hear about it, it sounds very exotic, and it's like, oh, I don't know. But I think one day, not too far away, there'll be a paradigm shift, and then the idea of tuning up your brain will just be self-evident, and everybody will be doing it. There'll be some kind of brain tune-up place on every block. I can't imagine that won't happen.
So in today's society, people may be doing their own version of tuning up their brains, or tuning out their brains in terms of whether it's alcohol, drugs, pharmaceuticals that are being prescribed to either numb or reduce the symptoms that folks are having because of things like anxiety and depression. This could do a lot to alleviate that?
Absolutely. In so many cases, people are what we call self-medicating, or doing things that try to help them cope with an out-of-tune system. And so certainly people are using prescription medications, non-prescription medications. Some people are addicted to running. They have to run, or else they can't sleep, they can't calm down, and so there's any number of ways. People do meditation, any number of ways that people deal with their nervous system, try to cope with a nervous system that's malfunctioning. I believe human societies all through history have had ways of coping, of retuning the system. Whether it was the Friday night dance or daily prayers or, prayers twice a week, or special ceremonies, healing ceremonies, and so on. There was always something for synchronizing the brain and the community and retuning your brain. But in modern society, there's two things going on. Our brains are much more frazzled than they ever were, and the opportunities to bring them into synchronization are far fewer than they were. Kids don't have grandma rocking them in the rocking chair. Instead, they're playing video games. So everything is much more extreme in the dysfunctional direction, and so it's little wonder everything is speeded up, that our brains are frazzled. So I feel that neurofeedback is a technology that came along kind of as part of the modern world, giving us what we absolutely need, that is a really requirement now for that, to bring our brains into tune. Because the only alternative would be more and more medication, and more people dependent on medications. And people have been taught to believe that we need medications for this, that, and the other thing. But taking medication comes at a price. There's always some downside. There's always some price you're paying. With neurofeedback, there's no price. It's truly balancing your brain, bringing it into optimal function, and there's no price to be paid.
Talk to me, the folks that suffer from anxiety and depression are the prime candidates for this. A lot of them are medicated in order to try to assuage the symptoms or calm them or put them in a place where they can get through their daily function. Can you talk to me a little bit about the process of using neurofeedback therapy for these areas, anxiety and depression, and how it works and what kind of results you get?
Okay, well, to fully answer your question would probably take about 2 hours, but I'll try to give the 4-minute version. Anxiety and depression are the most commonly diagnosed so-called mental disorders. In other words, for what we consider to be a psychological issue, a psychological problem with our functioning, anxiety and depression are by far the most common and the most often medicated. So, I don't know what the numbers are, but we know it's in the hundreds of thousands or more of people on prescription medications for these problems. And in most cases, the medication, it may be helping with the problem, but then there's some price that they're paying. When you really look at it, the varieties of anxiety and depression it's almost as many as there are people themselves. So each case has its unique qualities. So anxiety, for instance, you can have one person who's only anxious in very specific situations. The next person is anxious all the time, just a certain level of anxiety that comes and goes, or kind of reaches panic attacks, or is at a low level. Some people only feel anxiety when they have to, when they're going to work, when they have to speak in public. Kids get anxious at exam time, things like that. Or there's really situational anxiety where people normally aren't anxious, but they have a lot of stress in their life, divorce, house foreclosure, stuff like that. So there's a great variety of anxiety. There's some people who were born anxious and they've always had it. There are kids with a lot of anxiety. Some people who never knew anxiety until they were 30, 40 years old and then suddenly developed. So some, especially females, might have developed it along with depression, say, when they started their menstrual cycle. The hormonal change might have affected the brain, or the brain couldn't cope with it, and some kind of problem clicked in. So that's sort of the first part of the answer. The next one is dealing with anxiety and depression in neurofeedback are quite different. I can honestly say that the great majority of cases of anxiety can be very significantly helped with neurofeedback. I would never make a claim that this is a complete cure, that somebody comes in and then after a certain number of sessions they walk out, fully perfect. So even though I think that has happened, and I have seen it happen, where they just really don't have any more anxiety. But in general, I don't make promises, and because everything is very complicated. So, but the most people who come in either with pervasive anxiety, panic attacks, situational anxiety, will be very greatly helped with neurofeedback within not that many sessions either. On the other hand,
are we talking 6 months, 2 years, or less?
No, I'm talking for many people. It really varies, but let's say an average 10 to 15 sessions. On the other hand, if the anxiety is rooted in, let's say, some real ongoing childhood trauma, they were abused, they, physically, sexually, emotionally, and the anxiety is a product of that, then, we're talking of a longer process. But even then, I would say 10 to 15 sessions, we'd see a substantial reduction in the anxiety, but then we would need another 10 or 15 to really stabilize it. But in general, the way neurofeedback has advanced, it's more effective and faster than it used to be. So it's not even, rarely a 6-month course of treatment.
Okay, so but you're taking someone who might have suffered or been afflicted with this for years and years and years, potentially since childhood, but certainly maybe even in adulthood, they've been suffering or dealing with this for years, and potentially in a fairly short amount of time, you can see a great reduction in their anxiety. In this case,
that's really true.
That's got to be huge for people.
Yeah, it's really true, and it varies for each person. And some people, some change of life or some hormonal change or some experience, like a car accident, whiplash, for instance, sort of kicks something in, and they suddenly have this anxiety, and then just a few sessions of neurofeedback can kind of kick it back out. It sort of clicks the brain back to where it was before. But on the other hand, people who've had a long history, it's going to take longer. And where there's issues of trauma, things like that, you'd want the neurofeedback to be part of a multimodality approach. It helps them if they're in some form of psychotherapy as well. It greatly assists the process of psychotherapy. What I find repeatedly is people who've had a lot of anxiety, who are dealing with it in therapy, find that they're much more able to deal with difficult material in the therapy. In other words, they experience the neurofeedback first as reducing the anxiety and also as greatly facilitating the process of the whatever psychotherapy they're in.
Can you describe a little bit about it for someone who doesn't know that much about it or how it works? It's a non-invasive therapy, but what exactly do you, when someone walks in and they sit down, what do you do with them?
Well, it's amazingly simple, and it's so simple that that's part of the mystery of it. Like, how can this really, people are skeptical because it's how can it really work? Basically, what we do is we attach a few electrodes or sensors to the scalp at specific points, and the points depend on what part of the brain we feel, we believe is involved in the problem and needs to be balanced or calmed down. Then that goes, the EEG reading goes through an amplifier into the computer, and the computer analyzes the brainwave patterns as in live analysis, and then we program in how we think the brainwave pattern could improve, and sort of provide certain challenges to the brain that both improving the pattern and allowing the brain to be more flexible, so it's able to move in and out of certain patterns with greater flexibility. So then the computer, the person is watching a video screen, and we put on just any old, any movie or DVD, and it adds the feedback to the DVD. So as they're watching it, the screen is flickering. And other people who do neurofeedback, there are other forms of feedback. There's kind of fake video games that they've used with kids, where the kids sort of feel they're playing a video game. I used to do that. I don't do that anymore. I just use the videos. And so the flickering on the screen is telling, which is very, it's very complex how that came about, through the computer's mathematical analysis of the brainwave pattern. So the screen is flickering sort of in response. It's like a commentary on the brainwave pattern, and it's telling the brainwaves how well they're conforming to what the computer sees as a better way of doing things. The mystery part is, how does the brain pick this up and know that these flickers are talking to it? And it has to be timed exactly, the exact right milliseconds from when a brain event happened to when the flickering happens. If it's too longer or shorter, it doesn't work. So that came about through trial and error, I suppose. And then it works. And you just see amazing things. I've seen hundreds of times where people will, they'll calm down right there in the session. And they'll feel a calmness that they've never experienced before, right in the session, just from watching those flickers.
So we've discussed this before, but maybe you could talk about that. I mean, you must get a great joy and a great deal of satisfaction having come from the clinical therapy world to this, where you actually can almost day one, but certainly within a very short period of time, you could just see that light in somebody's eyes as they realize they're not burdened anymore or nearly as much with these issues.
Yes, it's for me. I've been in clinical work for I almost hate to say how long, but let's say my whole career, over 40 years. And this is by far the most rewarding and amazing work I've done. I'm just very gratified by it. And it's a whole new world. It's a whole new ball game. The previous clinical work I did was typical. There were there's psychotherapy and there's medication. And then since then, other forms of therapy have developed. There's the EMDR. Psychotherapy has become more sophisticated and varied than it used to be. But this is a new world. It's like, it feels like exploring a new continent. The continent of brain functioning itself. And it's, on the one hand, it's shocking to me how unrecognized this is. How in the medical profession, people get bounced around from one specialist to another, say after they've had a head injury or after anesthesia. They never came out of anesthesia properly because the brain didn't wake up properly. I've seen all kinds of things which the medical people didn't understand properly. Or there are these pain syndromes that are in the brain, not in the location where the pain is. And so there's all sorts of things that I feel that I'm on the work I do is on the frontier of a whole new realm of understanding how we function. And that a lot of people are looking for help. They're going around, getting psychotherapy, and it's just not effective for what they need. And this really is effective. Psychotherapy has its place when you have, there are all kinds of issues that I can't possibly deal with that psychotherapy would. But neurofeedback definitely has its place on this unexplored realm of brain functioning, the dynamics of brain functioning. And so to me, it's tremendously exciting as a professional to feel that I'm part of a small group of people. I feel like literally we're going around with our flashlights, kind of exploring this uncharted territory, and then coming back and kind of taking notes and reporting to each other. Even the issue of, say, head injuries, people who have head injuries and have what's called post-concussion syndrome, there's all kinds of things that can happen. And you would be shocked at how many people experiencing that go to their doctor, the doctor first gives them the pain medication, whatever, and then finally sends them up to the psychiatry department saying it's all in your head. Well, it is in their head, but not just mentally. So they get sent up, and there they go with the Xanax and the God knows what else, and then they start being hooked on these medications, which aren't doing them any good. And that's the state of our medical practice today. And I am to be honest, very, very happy to be part of a profession that's beginning to offer people an alternative to that.
And finally, Carl, if you could say to someone who might be seeing this, who suffers from anxiety, suffers from depression, whether it's mild or crushing depression in their lives, been struggling to find it, can you just tell me what you would say to them if they were to greet you on the street, and about what possibly you could bring to them in terms of helping them?
Okay, well, as I said, anxiety, I can say with great confidence that 99% of cases of anxiety I will be able to help. The only time would be problematic is if they're already on a lot of medications. And then we have to sort of work our way through the medication, because the medication is controlling, it's at the control panel of their brain. And before I can get to it, we have to start possibly reducing the level of medication. So, but aside from that, the neurofeedback will help their anxiety. Depression is quite a bit more complicated. And I always tell people, neurofeedback is likely to be of help, but we won't know how much until we get started. Very often depression is combined with anxiety, so once you are reducing anxiety, the experience of the depression isn't as severe. In other cases, there's certain types of depression in which the brain is sort of tuned too low, in a sense. It's, if you think of it as a musical instrument, and it's at B flat instead of C or something. And so this person is tired, they're lethargic, they're weepy and over-emotional, and then you sort of tune it, and you can tune them out of the depression. But I would say there are many cases of depression that are quite difficult to deal with. It's hard to know where the depression came from. It could be from particular experiences. It could just be they were born that way, or sometimes the depression kicked in. I've had people who became depressed following a car accident, where it was part of their post-concussion experience, and it was never diagnosed. The doctors never saw the relationship between the depression and the accident, even though the depression began for no reason whatsoever 3 to 6 months after the whiplash or the head injury. So that can happen. Each case is unique. But with depression, I don't make any promises other than neurofeedback is very likely to be helpful, and if they're in other forms of therapy, it would help that therapy. If they're taking medication, they could at the very least reduce the level of medication considerably without any reduction of the help they're getting from the medication. I also very strongly encourage people to eat good diets. So for most depressed people, let's say who are on medication, we can reduce the medication. They have to take nutritional supplements, eat a good diet, cut down on the sugar. There are certain nutrients that they absolutely have to have. And that, in addition to the neurofeedback, the great majority of people, we can reduce the depression to where they're more functional. But as far as getting rid of depression, I can say we can get rid of anxiety, but getting rid of depression is tricky. That's the best I can say right now.
Okay, very good. Thank you, Carl. Thank you for joining us today, and I look forward to carrying on this conversation in our next session. And folks can find out more at Carl's website, brainbalancer.com. And there you can find out where his offices are located and the services that he provides for neurofeedback therapy. Thank you very much for joining us today, Carl.
Okay, thank you.